Good afternoon and welcome everybody to this year's webinar on nursing demand and supply in California, current state and strategies for the future. This is Joanne Spetz at the University of California, San Francisco, and I am here presenting with some esteemed colleagues who've been working on this project with us for many, many years now. So I just introduced myself. The other presenters here are Teri Hollingsworth, who is the Vice President for Human Resources Services at the Hospital Association of Southern California, and Judy Berg, who's the Chief Executive Officer of Health Impact, which some of you may better remember or know as the California Institute for Nursing and Healthcare. They rebranded several years ago, so if you're not quite used to the new name, please do get used to it. They've been doing very important work around the state for a long time. So our goals today are to talk about how chief nursing officers are perceiving the current RN labor market from the latest survey that we conducted of CNOs, and to look at the latest hospital and vacancy and turnover data from the Hospital Association of Southern California's surveys, and then understand how recently graduated nurses are faring from Health Impact's ongoing surveys of recent nursing graduates. Overall, our goal is to try to answer the question of whether there is an RN shortage in California or will there be one in the future, and to assess our next steps for ensuring an adequate nurse supply. And I'll note that although our data are very California focused, I think that what we are learning in California applies to many other parts of the United States. We'd like to give thanks to our partners in this work. Future Sense has been the main partner for HASC in conducting their surveys of vacancy and turnover of hospitals on a quarterly basis. Leela Chu, who has been working at UCSF for a number of years now and is the lead author of the CNO survey report and the project manager. And then we had some other UCSF staff and interns that we'd like to acknowledge. Timothy Bates did a great job of helping to troubleshoot this report and contributing to prior reports. Betty Liu was our intern who helped telephone all of the chief nursing officers here. If you got a phone call, it was probably from Betty. And Lena Liebetique, who's been involved in all aspects of this work as well. So what is going on? These are some headlines that we have found nationally just over the past year or two, saying that the U.S. is running out of nurses. We're heading for a shortage. The headline on the bottom right purports that the shortage coming might be the worst yet. Hard to imagine worse than the one we experienced that went from about 1998 to 2008, but such are the concerns that we're beginning to see in the press. So we want to understand better what is going on with that and what CNO's telling us aligned with what we're seeing in the newspaper articles. So we've been doing a survey of chief nursing officers, and this has been fielded by UCSF for quite a number of years in collaboration with Health Impact and HASC. It's a web-based survey with an option to return a paper survey, and we've been doing these since fall 2010. So one of the key questions in this survey is asking about perceptions of employers of the overall labor market. The bottom set of bars are 2010, and then the top set is 2017. And we ask CNOs to respond on a 1 to 5 scale, where 1 indicates that the demand is much less than the supply available, and a 5 indicates high demand and it's difficult to fill open positions. So in general, we'd say that the areas that are colored green here indicate a balanced labor market, and then yellow and orange are different gradations of shortage, and then the different shades of blue are different gradations of surplus. So during 2010, which was really, I would say, the peak of the recession period, we still had about 36% of hospitals reporting that they were experiencing some degree of shortage, but more than half of hospitals perceived that there was a surplus of nurses. By the time we got to 2015, we had moved very, very solidly into perceptions of shortage among essentially about 85% of hospitals in the state. Very small numbers of hospitals reporting that they perceive that there is a surplus of nurses. 0% said that demand was much less than supply available in the past 2 years of the survey. It's been fairly stable over the past 3 years, but fairly stable with strong reports of shortage, are still strong reports of shortage. There are some regional differences that we see in the data. I do want to note that in 2016, we had very few hospitals from the southern border region, San Diego and Imperial counties, respond. So I would not take very literally the difference between the change in the scores between 2016 and 17. And for any given year, there's a different set of hospitals that report year over year. So we can't necessarily bank on the idea that a score goes from 4.2 to 4.1 and that that's meaningful, but there are some general patterns that we think are important to note. The Central California region, which would be Central Valley, Central Coast, and the Sierra region in the center of the state, consistently report deeper shortages than a lot of the other regions of the state. The San Francisco Bay Area, interestingly, has moved into reporting more shortages over the past few years. The Los Angeles area has more range in what hospitals are reporting to us, and the Inland Empire seems to have softened off a little bit in the degree of shortage after having been for quite a number of years the region in which the shortages appeared to be among the worst. We started asking in 2013 about experienced nursing shortages versus new graduate nursing shortages. And this has been extremely important for understanding what's happening in the data. So in 2013 through 17, you can see that the balance of hospitals everywhere except in the San Francisco Bay Area reported an average score of over 3. 3 would indicate a balanced market. 4 would indicate some degree of shortage, and 5 would be the most serious shortage. And average scores in the 1 to 2 range would indicate some surplus. So in 2013, in every region of the state, hospitals were reporting a tendency towards a shortage of experienced registered nurses, except the Bay Area was closer to a balanced market for experienced RNs. And then as we moved into 2014, 15, 16, 17, you can see that the statewide averages for experienced nurses very squarely put the state into the range of shortages, with perhaps the shortages being the least severe for the San Francisco Bay Area and being more severe for the Central California region, the Los Angeles area, but really there's not a lot of difference from a statistical standpoint for every region outside the San Francisco Bay Area. What about newly graduated nurses? If we look at the responses for that, it is quite starkly different. I'm just going to go back and forth so you can see. These are your experienced nurses. Here's the new graduate nurses. So for new graduate nurses, employers are continuing to report on average scores that are below 3, indicating some amount of perceived surplus of new graduates. That said, that perceived surplus has really changed and shifted towards closer to a balanced labor market, particularly in the Central California northern part of the state. The southern part of the state, Los Angeles, Inland Empire, and southern border counties are leaning more into perceiving that there is a surplus of new graduates. So this does align with some of the data you'll hear about in a few minutes, indicating that new graduates from nursing programs are finding it easier to get jobs nowadays. There have been historically differences between urban and rural areas, where in general the rural areas of California are more prone to reporting shortages than the urban areas. In the most recent year, the rural and urban average scores were the same, which is a little surprising given the historical trend towards rural areas having greater shortages. Again, that may just be an artifact of which hospitals happen to reply this year versus it representing a true trend or a true change that will persist in the long term. We asked about the employment of temporary and traveling nurses and how that might have changed over the past year. So this would be asking in fall 2017 how they perceived changes in their employment of temporary and traveling nurses prior, basically over the calendar year of 2017. And you can see that over this time, there were more hospitals that indicated that they had decreased their employment of travelers and temporary nurses than had increased their employment. Similarly, more had indicated they had decreased their employment of temporary agency nurses than had increased. So that indicates some trend away from reliance on temporary and traveling nurses, although a lot of employers indicate that they are still hiring and using a lot of temporary and traveling nurses. We also ask about recruitment of internationally educated nurses, and this year there was a notable increase from 5.7% in 2016 to 9.7% in 2017. Again, this could be an artifact of which hospitals happened to respond this year. We were quite surprised by this jump because it does not align with what we're hearing more anecdotally from hospitals around the state. So we will have to see in future years if this represents a real movement towards international recruitment or if it's that we just happen to get responses from the 9.7% of hospitals that are doing it now. Hospitals also indicated some growth in the percent of their new hires that were new graduates. In general, this has been pretty stable at about a third of new hires being new graduates, and it moved up to 37% in 2017. So a little bit of an increase there, which perhaps represents the beginning of a trend. We will have to see. About new graduates, chief nursing officers were asked about their hiring requirements and preferences. And again, these numbers are probably very subject to who happened to respond to the survey this year. But we had about 15% of hospitals indicating this year that they had no specific requirements. The most common specific requirement was requiring minimum experience, which is about 42% of hospitals in 2017 said for positions they have open, there is a minimum experience requirement. And about 55% indicated that they prefer a baccalaureate degree, which is a decline from about the 2011 to 2014 or 15 period when it was closer to 2/3 of hospitals said they preferred a bachelor's degree. We've had a lot of change bouncing around between 5 and 9% of hospitals indicating that they require a bachelor's degree. So the increase between 2016 and 2017 from about 4.5% to 9% might be just within that natural range of variation associated with who the survey respondents are year to year, or it could represent more of a movement towards requiring the bachelor's degree, and we don't know yet how that's going to play out. Employers were asked about their plans regarding bachelor's educated nurses, and about 2/3 said they plan to increase the share of nurses with a bachelor's degree, which is the same as last year. About 14% indicate that they require that newly hired RNs have a bachelor's degree within a certain time period if they don't already have one. Last year, it was about 10%. 58% require a bachelor's degree for promotion beyond the staff nurse level, and this is very consistent with the past few years. And nearly a third differentiate RN salary by education degree. Last year it was 40%. This is probably within the range of variation you would expect given variation in who the respondents are year to year. Employers were asked about the challenges that they face in increasing the share of bachelor's educated registered nurses. The most common barriers to increasing the share with a bachelor's degree are a lack of interest among incumbent RNs, a lack of tuition reimbursement funds to help support current employees into pursuing the bachelor's degree, and then a lack of funds to provide financial incentives for those who do complete a bachelor's degree, which is probably related to the lack of interest among incumbent nurses. CNOs were also asked about residency programs for new graduates who are not guaranteed to be hired. So these are distinct from an onboarding type of residency where the new people that you've hired are brought through a formal structured orientation program, which nowadays most hospitals are offering. These are residency programs for non-employee new graduates who are not guaranteed to be given a job when they complete the program. So a third of hospitals, or nearly a third, 29% of hospitals in this survey reported a new residency program or currently running a residency program for non-employee new graduates. And this has been a continuous increase over the past several years. It was 18% in 2014. 70% of the programs are offering a paid program, so it's not volunteer. There is some amount of compensation for the work. Nearly 3/4 of hospitals said that at least 3/4 of the residency completers were hired in the past year. And only 16% of those with a residency program said that they hired less than a quarter of the completers of the residency. So while these are residencies for people not guaranteed to be hired, the vast majority of hospitals are hiring the vast majority of the people who are completing their program. Finally, the most common clinical areas that the residencies focus on are medical surgical, emergency department care, and critical care. Although we should note that just about any clinical field you can imagine showed up in the list of clinical areas of these programs, ranging from behavioral health and psychiatric related services through care management, through neonatal intensive care, through labor and delivery. CNOs were asked about their hiring expectations for the next year. Green indicates they plan to hire more than last year, and orange indicates hire fewer than last year. There's been a little bit of a backing off regarding intentions to hire more than last year as compared to the respondents from the past couple of years of surveys. We suspect that this is related to the Affordable Care Act's growth in insurance coverage in California stabilizing. When respondents were answering in 2015 and even 2014, that was right after the insurance expansions of the Affordable Care Act. So Covered California and the Medicaid expansion of, for our Medi-Cal program had brought many, many Californians into health insurance who didn't have it before. And with health insurance increases also comes increase in the demand for care. So I think employers, hospitals, felt that there was this growth in the demand for services and accordingly were increasing their new hiring overall of both experienced nurses and new graduates in order to meet those care needs. Now that the growth in health insurance and coverage in California is stabilized, we suspect that that has led to some stabilization of the hiring needs, although we will continue to have population growth across the state, and the aging of our population will continue to demand more care. So that is why we think that we see the trend that you depict here. Employers were asked about their expected RN hiring for care settings within their hospitals over the next year. And you can see that across all the areas, hospitals are expecting more hiring versus more hospitals expect increased hiring than expect decreased hiring. The greatest amount of increased hiring was expected among hospitals in inpatient care, although nearly 10% of hospitals anticipated a lower rate of hiring over this next year in inpatient care departments. But ambulatory care, home health care, and case management all also had significant expectations of hiring increases over this upcoming year. With respect to new graduates, the patterns are very similar to the expected hiring of nurses overall. After a peak in anticipated growth in hiring in the 2015 and 2016 surveys, in 2017, about 32% of hospital respondents indicated they expect to hire more new graduates over this next year. About 9% they expect to hire somewhat fewer graduates, new graduates than this prior year, and about 60% are going to remain stable. For those that expect an increase in new graduate hiring, the most common reasons that they reported for this were a lack of available experienced RNs, that they anticipate more retirements of experienced RNs, so they're preparing to fill those positions, difficulty offering competitive salaries to experienced RNs, and that they are intentionally developing programs to mentor new graduates so that they're better in a position to bring in new graduates for their hiring. Many hospitals reported all of these or more than one of these in their responses. So now I'd like to turn it over to Teri Hollingsworth to tell us about the latest hospital vacancy and turnover data.
Great. Thank you so much, Joanne. Thank you for having me. My name is Teri Hollingsworth again. I'm the Vice President of Human Resources Services with the Hospital Association of Southern California. And for those of you who are not aware of the Hospital Association, we are a regional trade association representing the interests of over 180 hospitals across the Southern California region. Today, I'll be presenting to you data that comes from our third quarter of 2017 HASC Healthcare Workforce Report that is completed by human resources professionals in hospitals. And this information comes from over 234 hospitals. So on this slide, we ask hospitals to report RNs hired during the third quarter of 2017. This slide examines trends of specific nurse categories. And as you see here, for the staff RNs and other RN categories, for 2017, it has the highest hiring rate. And perhaps this speaks to more nurses retiring and the fact that we're well past the Great Recession. Also, we know that specialty RNs and other RNs are in great demand due to the changing needs of organizations, which might have an impact on these numbers as well. And then also the LVN hiring rates are lower in 2017, possibly due to LVNs finding employment opportunities in other healthcare settings, such as non-acute and ambulatory care settings. Next slide, please. We also asked hospitals to report on their vacancies during the third quarter of 2017. And as you can see here, 7 out of the 8 years reported, RN vacancies are consistently increasing, which may be due to, again, the Great Recession being well behind us. Therefore, nurses are now able to retire. And also, nurses may be more comfortable with seeking different employment opportunities for either higher wages, better culture, etc., given that the higher rates are better than they have been in the recent years. Next slide, please. And this slide shows the turnover rates for the various nursing categories, which remain somewhat consistent with some variation, which could be attributed due to the different hospitals reporting year over year. One interesting note that I'd like to report out that's not included on this slide is that during the fourth quarter, we collect information at the Hospital Association asking HR professionals to report on the RN length of service before termination of employment. And based on the most recent 2017 information, approximately 43% of RNs hired terminate employment either voluntarily or involuntarily from the hospital within 2 years of hire. So I think that that's something that we have to watch, and perhaps hospitals need to review their recruitment and onboarding strategies to help improve with employee retention and engagement. Okay, back to you, Joanne.
Great. Well, actually, we're going to turn it over to Judy Berg to tell us about the survey of recently graduated nurses that Health Impact has been doing and the latest data from that.
Thank you, Joanne. Next slide, please. This is a survey that Health Impact has been doing since 2010. So I will be able to share data from about the same time periods that Teri and Joanne have been sharing data to give you a well-rounded picture of what's going on in California. The study team for this survey, back one slide, please. The study team for this survey is a partnership between Health Impact and the California Board of Registered Nursing this year. And I want to give particular thanks to Carolyn Orlowski on the Health Impact staff, who's the principal investigator for this survey and also the principal author for the survey itself. And just to let you know, the full report of this survey is available on the Health Impact website, www.healthimpact.org, if you want to read a more detailed report. Next slide, please. I want to also thank our multiple funders for this survey. This year we had 7 organizations step forward and provide funding for this important survey, and I thank them each. Next slide, please. The sample size for this survey is a random 50% of all of the newly licensed nurses in California between September 2016 and August 2017. It's the same time period in the year that we have used in each of the previous surveys. And the response rate was 28%, which is exactly the same as it was last year. Next survey, please. Next slide, sorry. Here's the profile of who responded to the survey, and it mirrors very closely, as you can see, the statewide graduations with slightly more baccalaureate graduates responding to the survey than graduated in the state. Next slide, please. And this shows, again, the respondent profile in terms of where graduates were in the state in terms of responding to the survey. And again, it very closely mirrors where schools of nursing are in California. And you can see that the Los Angeles and Orange County Inland Empire area of the state comprise almost 50% of the respondents of the survey. And that is true in terms of the numbers of graduates in the state, in terms of where they're going to school in the state. It's very closely aligned. Next slide, please. So here are the results that show what the experience has been in terms of hiring of newly licensed nurses in California. And of course, as Joanne has mentioned, there was a very different picture in California during the time of the Great Recession. And our newly licensed nurses in California were really struggling to find those first positions and gain the experience that was so important to employers. And it wasn't really until about 2013, 2014 that we started to see the hiring patterns open up again for newly licensed nurses, continued to climb in 2015, 2016. And in fact, between 2015 and 16, there was a 10.5% increase in the hiring of newly licensed nurses. In the most recent survey, we saw a drop to 81%, and that's a 3.6% decline in employment, which concerns us a little bit. Although it's small, we need to closely monitor this, particularly when we consider that the margin of error is about 2.5%, so a little bit less than the actual drop that we saw. So something for us to be aware of and continue to watch. Next slide, please. We do, of course, in a state the size of California, expect some regional differences in hiring, and that's exactly what we experience. We can see on this slide that the Central Valley of California has the highest hiring rates in the state, and in fact, 93, slightly over 93% of newly licensed nurses in the Valley find employment within that first year. We see areas like Sacramento, San Francisco Bay Area, there are a little bit more of a challenging environment in those areas. North Sacramento Valley as well this year. There was only one area of the state where there were more newly licensed nurses hired than the previous year, and that was the Central Coast of California. Next slide, please. So we also want to look at the employment experiences of graduates and newly licensed nurses based on the degree that was their initial pre-licensure degree. We looked at the differences between those newly licensed nurses coming from associate degree programs versus baccalaureate and entry-level master's programs. And as we have seen all along, there have been differences. They're not huge differences. They're relatively small differences in terms of the hiring rates, but we have seen higher hiring rates for baccalaureate graduates than for associate degree graduates. We've seen the entry-level master's graduates bounce around quite a bit, and that may have more to do with the structure of those programs in that they do not finish their master's degrees prior to licensure. Many of those graduates take the NCLEX exam during the course of their study and choose to delay employment voluntarily until they return, until they graduate from their program. We may be seeing some changes in that as the new graduate market strengthens and newly licensed nurses have more opportunities for those first jobs, and that may be what's happening in 2016 and 2017 as we see employment rates rise for those entry-level master's newly licensed nurses. Next slide, please. So Joanne had talked earlier about the perspectives of the employers in terms of their degree preferences. And this shows you some data over time that demonstrates that even as recently as last year, close to 40% of new graduates were saying that the reason they didn't get a job was because they did not have a baccalaureate degree. And now we note in 2017, that number has dropped by almost 50% in terms of being a reason for newly licensed nurses not being given a job offer because they don't have a baccalaureate degree. And again, that may indicate a loosening of the employment market for new graduates and an increasing need on the part of employers. As Joanne mentioned earlier, the percentage of hospital employers requiring a BSN upon hire has jumped to 9%, which we've seen in previous years. We've seen numbers that high. And preferred is at 54.9%. So while that number has remained relatively stable from the previous year, it is less than previous years. So something to watch, be aware of, and continue to monitor the trends in that area. Next slide, please. This slide shows where newly licensed nurses are going for that first job. And not too surprising, it is to hospitals. However, only about 2/3 of those new jobs, those first jobs for newly licensed nurses, are in hospital inpatient areas. And that is a change that we're beginning to see. 10 years ago, most of those first jobs were in hospital inpatient areas. Now increasingly, as hospitals expand their reach into ambulatory and outpatient settings, we see new graduates moving into those positions as well. So now 16% of the newly licensed nurses' first jobs are not in inpatient areas, but are in hospital outpatient areas, and increasingly in areas like community, long-term care, rehab, behavioral health, etc. So quite a change here as we see that there are more and expanded opportunities for newly licensed nurses in settings other than inpatient settings. Next slide, please. We also ask about participation in a transition to practice or a residency program, and are really pleased to see that there are more of these opportunities being extended to newly licensed nurses in these first jobs. And in fact, employer-provided participation is now just under 55%, so over half of newly licensed nurses are participating in a residency or a transition to practice program provided by their employer. This compares with last year's data that indicated only 42% of employers were offering these programs, or only 42% of newly licensed nurses had the opportunity to participate in a program that was provided by their employer. Some of these newly licensed nurses had also participated in a School of Nursing provided program that may or may not have been part of been offered with compensation or through employment experiences as well. And a total participation rate of about 59%, which is wonderful. That's the highest level of participation in a new residency program or a transition to practice program that we have seen during the entire time we have been conducting this survey. So well under the 100% goal that we would like to see, but certainly moving in the right direction. Next slide, please. This slide gives us some insight into the robustness of these residency programs. Some of them are 1 month long, all the way up to 12 months long. And the most popular programs are about 3 months long, followed then again by a 12-month residency program. And we know that the evidence of best practices would indicate that a 12-month program is the most beneficial for the newly licensed nurses. We also ask for those nurses who don't have a job yet, what's the reason? And the top reason, of course, is no experience. That has been the top reason all along the entire time we've done this survey, and no surprise this year. The second most frequently given response is that there are no positions available, which would correspond to some degree to Teri's data in that, and Joanne's data in terms of some employers decreasing their hiring. And then the BSN preferred is something that's still out there, although much less, as I indicated, than it was last year. One of the reasons not given this year, and it fell off as a significant factor, was that work experience was not applicable. So we did not see that in the top reasons for lack of employment this year. And with that, I'll turn it back to you, Joanne.
Great, thank you, Judy. So we wanted now to turn to the question of whether there is a nursing shortage in California and whether there'll be one in the future, because the data are showing us high demand for experienced nurses and still perhaps some softening of demand for recent graduate nurses. Vacancy rates are rising a little bit, and we're wondering where things are going to go next. So let's just recap. We know that there's current and anticipated job growth. There has been ongoing increase in hospital census and higher acuity, but that demand for nurses does seem to have stabilized a bit after accelerating with the economic recovery and the implementation of the Affordable Care Act. We also specifically hear from hospitals that they are concerned about a lack of nurses prepared to work in the operating room, labor and delivery, emergency departments, and intensive care units. And that hospitals are aware that there are anticipated to be significant retirements of RNs as the baby boomer generation continues to age. Fortunately, California nursing education programs, starting in the depths of the last shortage, made a big effort to increase the number of graduates. Over a decade period, the number of graduates more than doubled. If we started counting, if this chart went back to 2000, you would see more than a doubling of the number of new graduates. And even through the recession, our nursing education programs maintained our number of graduations as pretty stable at around 11,000 to 11,500 per year. This bodes very well for the overall statewide labor market for nurses. These are forecasts that are published in the Board of Registered Nursing's forecasts of RN supply and demand. You can download the full report from their website. The green lines indicate supply. The solid green line indicates our best supply forecast, and the dashed green line indicates the low supply forecast. And you might wonder what the difference is between these, and it's the low supply forecast could come from a decrease of even only 1% per year in the number of graduations, and if the number of people moving out of California is on the higher end of what we've seen over the past decade, and the number moving into California is on the lower end of what we've seen in the past decade. If those patterns were persistent, we would have a declining supply of registered nurses. But our best guess, based on past trends, is that we will probably be on that solid line, which would indicate ongoing growth in our labor force for registered nurses. The three red lines are alternative ways of projecting what the demand for nurses is. The solid red line is based on the current employment levels as reported in the Office of Statewide Health Planning and Development's surveys of hospitals, and looking at a projection of demand growth associated with aging of our population and anticipated demand for healthcare growing aligned with the growth of the population and aging of the population. The two dashed lines are the national 25th percentile of full-time equivalent RNs per population. In other words, what would it take for us to be ranked about number 36 or 37 in the country instead of ranked number 46 or so in the country? And then the dashed line is the national average FTE RNs per population. So we're on a trajectory to hit the national 25th percentile over the next 17 years or so. And there's a lot of debate that we could have about what the true need is in California, because we know that we have a younger and healthier population than many states, and our very well-established, long-standing managed care structures also lead to, in general, lower healthcare utilization rates and better health outcomes than many other states in the country. But even though statewide, we may think that supply and demand look pretty well balanced, there are some notable regional differences. We had the opportunity this year to do some projections for the San Joaquin Valley of California. These are published on our website. And we found that if you look at the solid line for the San Joaquin Valley, the projected supply of RNs in the San Joaquin Valley is going to drop over the next 18 years based on current graduation patterns, current patterns of new licenses being issued in the area, and so on. But because population growth in the San Joaquin Valley has been so notably high compared to the rest of the state, the demand for nurses in the area is going to grow quite steeply. Whether you look at it based on adjusting for aging of the population, the solid red line, or you look at trying to target the 25th percentile or the national average, the San Joaquin Valley already has among the lowest RN to population ratios in the state and is not going to be getting any better unless we make some effort to change that. It's worth noting that there has been some research conducted in surveys of recently graduated nurses. Christine Kovner and Carol Brewer did these surveys and documented that more than half of nurses, I think it's about 60%, live within 40 miles of where they went to high school. So while nursing is an incredibly mobile profession and has a lot of potential to live anywhere in the United States or anywhere in the world to practice nursing, most nurses live and work fairly close to where they grew up, which means for the Central Valley, we need to be attentive to that when we think about increasing the supply of nurses in the region. So that brings us to assessing some next steps for ensuring an adequate nurse supply. And Teri, Judy, and I spent some time talking about this together and have a number of recommendations, which honestly we have made in past years as well. So some of these are things you've heard us recommend before, and they don't change. We need to target our education growth in the state to the areas with the greatest shortage. We've got overall the right number of nurses in California, but we know that we don't have enough for the Central Valley. And I think if we had the opportunity to do these kinds of forecasts for other regions of the state, then we would probably find that some regions are projected to have an ample supply of graduates, and other areas are going to have shortages emerging in the future if they don't have them already. The faculty vacancy rate was about 8% in the 2016-2017 academic year, and nearly 20% of faculty are 61 years or older. Now, faculty can work for many years in those positions, and we don't know quite how rapidly they're going to retire, but we do need to anticipate retirements of faculty, and that coupled with an already high faculty vacancy rate means that in order to expand education programs in the regions with the greatest need, we also need to think about the availability of faculty in those same regions. There's a lot of opportunity for educators to partner with employers. Some are offering electives in the clinical areas where they're experiencing shortages. So the educators are hearing from employers, we have a shortage of operating room nurses, or we know that we're going to have retirements in the operating room, and they partner to offer an elective. Expanding partnerships beyond acute care settings is something that educators need to be looking at. Given the rising behavioral health needs and long-term care needs of our population, those are some opportunities. Recruiting students who are more likely to work in underserved areas is important. The research shows, again, that people tend to work close to where they grew up. And we know from a whole broad variety of health workforce research that people, for example, from rural areas are more likely to return to rural areas after they complete their education for their practice. There are also some opportunities for distance learning that we can take advantage of to help provide educational opportunities in areas that are currently underserved. New Mexico has a very innovative program where the University of New Mexico is partnering with community colleges in the more rural areas of the state to offer joint bachelor's degree programs. And historically, in the mid-2000s, the California Nurse Workforce Initiative supported some programs that Bakersfield College operated with distance learning modalities at Porterville College and Delano Center to, again, offer education at the RN level in distant sites. There are also, it's very important for the educational community to include employers in education program content discussions. Employers also have a number of things that they can do. They really need to support new graduate hiring and education. It will be much less expensive to invest in new graduate hiring and new graduate onboarding than to allow a shortage to emerge. And we did see recognition of that in the survey. We had a growing number of hospitals say that they are hiring more new graduates because they feel like they don't want to spend as much money as experienced nurses are costing right now. Relying on travelers in the short term can help fill gaps, and travelers also can help provide additional bandwidth for the onboarding of new graduates. But relying on travelers in the long term, we know, is a ticket towards high costs. Providing clinical faculty to nursing education programs and exploring joint appointments with nearby education programs can be important, particularly in the areas where the projected and current shortages are the worst. And inviting faculty to sit on practice committees so that faculty better understand the needs of employers is another important strategy. For those RNs interested in pursuing advanced degrees, offering some flexible scheduling can help them obtain a bachelor's degree and also can help them move into the master's and other doctoral level education roles, which could help pave the way for more faculty in the long term. And investing in transition to practice and residency programs is important. Finally, we recommend that employers pay a lot of attention to retaining nurses who are approaching retirement. What are the flexible opportunities that they can offer so that retiring nurses feel like they don't have to retire and they might be able to contribute to nursing in the long term, such as by being mentors to new graduates or even working just part-time or in a per diem type of role so that their expertise is still available. Finally, state leaders can invest in a number of ways. We need our policymakers to maintain our education capacity, and if there is growth, to target it into the shortage regions of the state. We definitely do not want to let the number of enrollments drop, but there could be shifts from some regions of the state to other areas if we just maintain our enrollment numbers in total. The state can also continue to support scholarship programs, such as those offered by the Health Professions Education Foundation, and support non-traditional clinical placement settings and use of simulation, which helps address problems with a lack of clinical sites that might exist in traditional hospital-type settings. We also think there's opportunity to continue to support distance learning strategies and to think about how those can be supported and best practices can be promulgated across the state. So Judy mentioned the Health Impact website, which is really important for you to take a look at. They have an email list that you can subscribe to, and they publish a lot of different reports based on all of their research, as well as if you keep an eye on their other social media feeds, they link to other resources. From our website, rnworkforce.ucsf.edu, we have updated the demand data dashboard, which is, you can see the tab there on the screenshot, to have this newest data so you can look at various metrics by region across the state. And we are in the process of updating the supply data based on the 2016 Board of Registered Nursing Survey of Registered Nurses. We will be updating the education data over this next year. We are transferring to a completely new platform for the education data. So it'll take us a little longer to get the new annual school survey data up onto that tab. These have the interactive data displays. We're now using Tableau, which means you'll be able to see it on a tablet. That's been true for some of our different resources, but not all of them. And again, you can look at these regionally or statewide. And then the Board of Registered Nursing website, they have all sorts of reports available on their webpage, ranging from the Sunset Review reports to the annual school survey that they commission every year, and then the biennial surveys of RNs. So these are all resources you can go to. So we have a bit of time for some questions and feedback. And if you want to provide a question, please do it through the chat room that's available online. So Teri, a couple of clarifying questions for you, or I guess a clarifying question and then a comment. The question has been about what percent of nurses appear to have departed in the first 2 years of their employment. But then also just an observation that your comments about the length of employment during the fourth quarter of 2017, that about 40% of RNs were transitioning within 2 years of hire. The commenter indicated that some general data that they've seen from the millennial population, not just registered nurses, show that millennials change job every 2 to 3 years. So do you think that your results are largely due to newly emerging millennial patterns of employment, or do you think that there might be something distinct going on in addition to millennial patterns of employment?
I think it's in addition to millennial patterns that's going on. You know, again, this was outside of the third quarter data collection period. Typically, we include in the fourth quarter of our survey additional questions to help us understand exactly some of the trends and patterns that we're seeing. And, you know, the data clearly showed that was submitted by the HR professionals that 40% of those nurses within 2 years of being hired tend to terminate or transition outside of the organization, either voluntarily or involuntarily. But I do believe that it's a combination of issues. But there's always a good opportunity for hospitals to examine their current onboarding and retention strategies to help ensure the success and retention of those nurses being brought on.
Thanks, Teri. So a question just came in about the Board of Registered Nursing approved an increase in the licensing fee, and I believe licensing renewal fee, and whether we thought that would have any impact on the supply of nurses in California in the future. I'll have my guess, and then I'll let Teri and Judy respond as well. My guess is it probably won't have much of an impact. Our licensing fees are still not particularly high relative to a lot of other states. It may affect the willingness of a nurse who is a traveler nurse to maintain a license in California if they live elsewhere and are not sure if they'll ever work in California again. But I think for our resident population, I can't imagine that that fee increase would be driving nurses to Nevada to work instead of in California. Teri, Judy, do you have a different take on that?
This is Judy, and I would agree with you, Joanne. I think that our fees in California have historically been low compared to many other states. And if there is an impact, it's going to be on nurses who don't live in California and only work here periodically.
Great, thank you. Let's see. So A question came up, and I think this would be a great question for Judy to think about. What areas outside of the hospital would you forecast are going to have the most notable growth in the future that our newly graduating and young nurses might want to think about for clinical opportunities?
That's a great question. And when you think about where there are opportunities other than inpatient areas, the first area that comes to my mind is behavioral health. We know that in general, behavioral health, people with behavioral health needs are largely underserved, and that there is a lot of conversation right now about how to do that better and how to perhaps even connect it with primary care in ways that make it more accessible for individuals who need that level of care. So I think behavioral health is one of those areas of opportunity. I think long-term care is certainly one of those areas of opportunity. And when you think long-term care, that's home health, that is residential care, it's long-term care facilities. There's a whole spectrum of services that go into long-term care. I think we're going to continue to see growth and dependence of our population in those particular areas. And I think a new area for nurses, or perhaps an area that we will return to, is primary care. There are real opportunities for nurses to be members of teams in primary care setting, and through their participation in those teams, expand capacity of those primary care providers to more individuals. And particularly when I think of underserved rural areas in the state, I think that's a real golden opportunity for newly licensed nurses.
Great. Let's see, I'm going to answer two clarifying questions quickly, and then another really interesting question. VA hospitals were invited to participate in the CNO survey. And of course, VA employed nurses may be in Judy's data. Teri, does the VA participate in your survey work?
They are invited to participate, but I don't believe that they do on a regular basis.
Okay. And then for those of you who are interested, there was a question about, is there a map of the various regions and so on? There is a full report now posted on the RN Workforce website of the CNO survey data. And if there's not a map in there, we can easily help you find one. So let us know. So, going back to the millennial population, somebody asked about whether the hospital employers or any other employers are hearing about preferences of millennial workers for different length shifts than the more common 12-hour shifts, and whether that might be a factor in trying to retain and recruit younger nurses.
That has not come up in the work that we do at this time. So I really can't speak to that. That has not been raised as an issue up to this point.
Great.
And this is Judy. I was going to mention that even anecdotally, I haven't heard that come up, Teri, or Joanne. In fact, what I've heard anecdotally is the reverse of that. And as some nurses reach retirement age, or really even move beyond retirement age, they're looking for flexibility in the schedules so that there are alternatives other than the 12-hour shift, because that's just a long time to be on your feet and moving around, and looking for shorter or alternative shifts, not in the millennials, but in probably the baby boomer employee category.
Great. Yeah, I think there was a very interesting little period of time when the California's minimum nurse to patient ratios were first implemented, where some hospitals established positions that were essentially lunch break rotation shifts, where somebody would come in from about 10 to 2 and give everybody their lunch break and cover their patients during those breaks because of the requirement that the ratios be met at all times. There was a lot of interest in those positions because for people who might have young children and not want to have childcare outside their own provision of care for the kids, working from 10 to 2 accommodates a child's school schedule perfectly. So there may be some opportunities for employers to think about different kinds of scheduling that would be very attractive to both younger nurses and older nurses. A question was raised or asked by Tim Dahl, who many of us know because he is the lead of the federal forecasts that are done of nursing supply and demand. And Tim asked, to what extent might the increased hiring demands over the past few years reflect replacing nurses who've retired versus a net increase in employment due to higher insurance coverage? Judy and Teri, what are your thoughts on that? What's your intuition on what that range might be?
Wow, I have no idea. I mean, maybe Teri's got some data on that, but I think we've only begun to see the retirements begin to kick in. I think we had a bit of a delay on that in California, and maybe that was nurses just waiting to make sure that the economic recovery was real and was going to continue. But I think we had a little bit of delay in that in California. I think we're only beginning to see that start to happen now. So the degree to which there was, demand as a result, boy, I would struggle with that. Teri might have the answer.
You know what? I don't have. We have information from the Los Angeles Economic Development Corporation and probably other local economic development corporation on new hires versus replacement, but it doesn't carve out nursing exclusively. I think that this might be an opportunity, though, for us going forward to be able to capture this data in both of these categories so that we can clearly see those new hires positions versus replacement. But as it stands right now, we do not have the information on hand.
Great. That's, I would agree with you. I don't think we entirely know what the relative differential is there, but my guess is that the retirements are maybe beginning to hit, but not a lot. We know that during the recession, anecdotally, a lot of hospitals said that some of the nurses they anticipated would retire didn't retire because they were probably trying to have their retirement portfolios recover from the stock market crash. But that as those did recover, then we are seeing some retirements, but really much more of kind of the normal rate that one might expect. Mm-hmm. So there's a kind of an intriguing question here about whether we think that taking that we know that we've had a long trend towards LVNs not being in our hospital settings to the degree that they maybe were 20 years ago. The question is, do we think that this has had an impact on the shortages of experienced nurses, and could experienced LVNs help soften the blow of experienced RNs retiring?
This is Judy. I'll just take a first pass at this one. I think generally speaking, in the acute care setting, I think the lengths of stay are so short and the intensity of services and care is so high that hospitals will continue to use registered nurses in those settings because of the care requirements of the patients. I think LVNs and the growth in hiring of LVNs will be in those non-intensive, highly high need acute care areas. So we'll probably see growth, I'm sure, in home health, in long-term care settings, in clinic settings, in those settings that don't require that high intensity of services that you find in the acute care settings. But I think for sure we will continue to see need for LVNs probably grow in those non-acute settings, particularly as we continue to find innovative ways to move care into communities and into homes.
Great, thank you. Yeah, that what you're saying aligns with what we have seen in national data. LVN employment has continued to grow, even if not in hospitals nationally. And a lot of that growth has actually been in home health type of environments, where home health agencies need people who are authorized and licensed to administer medications and have strong nursing skills. But so many LVNs have experience in nursing homes and long-term care facilities that it's a very easy move for them to be in the home health environment frequently. So, we are past time, but there are a few questions here that are asking about availability of the information and data. So we will be turning this PowerPoint into a PDF and posting it on our website. And if you are interested in any of the slides in original PowerPoint form, let me know. We are happy for you to use the information with citation. We want to make it available to as many people as possible. There was a clarifying question about what share of our workforce has a bachelor's degree right now, and in 2016 it was about 57%. So we are above the national average by about by about 6 percentage points right now. And for those who might be interested in the nurse practitioner workforce, there are two resources we'll point you to. One is that we did forecasts of primary care supply and demand. That was supported by Kaiser Community Benefits Program, and that is posted on the Health Force Center website, which is healthforce.ucsf.edu. There are forecasts there for primary care physicians, NPs, and physician assistants. And the nurse practitioner growth in California is quite strong, which is great because we are expecting a decrease in the number of primary care physicians in the state. And then there are all kinds of other reports that you will find both at the RN Workforce website and at the Health Force Center website and at Health Impacts website. So feel free to email any of us. We're happy to provide more information, and we always want to be a resource to you. And let us know if there's more information or data that would be helpful to you, because if we have it, we will give it to you. And if we don't have it, we'll help you figure out how to get it. Thank you so much for participating today and joining us, and we hope that you all have a great rest of your day. Thank you very much.